people.
Dr. DK Gupta, do you believe also, like Dr. VK Paul has said, that there could be that many lakh cases, 14 lakh cases every day after this Omicron surge? Can we prevent that, or are we headed in that direction already, Dr. DK Gupta? Because we are all seeing how the UK is breaking record day after day, and that is being attributed to the Omicron surge.
I think we are having the same problem or same scenario that we have last year during the Delta wave also. In January last year, there were a few cases in India, and till March, April, there were huge cases, number of cases increased, and there was a second wave, and we were not able to manage that wave also. And there was a demise of several people in each and every family in that second wave. And same thing was happening in the UK at that time, just before our Indian scenario, but nobody took it seriously. Nobody took it seriously. Nobody took it seriously. So I think this is a high time we should know that the virus has high infectivity. It is 4 to 5 times more infectious. It is having replication rate more than 70 times, and we got to know from the Hong Kong study that it replicates more than 70 times, but the replication is limited mainly to the upper and middle lung, that is till up to the bronchus only. It is not going to the lower side of the lungs, that is in the alveoli. It means it will less cause pneumonia and ARDS. But we have a huge population of 1.35 billion, that is around 135 crore, and if it comes in India and with a similar rate, if we have 10 to 15 lakhs cases per day, what will be, if there is a 0.1% mortality rate also, then it will be significant. And hospitalization rate, it's less also, then it will be significant. We will not be able to provide beds also. So I think this is a huge high time we should think about the booster dose, that because we know the efficacy of the vaccine is less against this Omicron. WHO has already told day before yesterday the current vaccines are not efficacious, or they are less efficacious against this Omicron. But still there is efficacy. The government should consider about the booster dose as early as possible, specifically for the frontline workers and the comorbid patient, because we cannot develop new vaccine in 1 month or 15 days and we can inoculate the whole population within 1, 2 months or 3 months. It is not possible right now. Therefore, whatever vaccine we have right now with lesser efficacy also, the booster dose should be immediately allowed to the frontline workers, including doctors, paramedical nurses, and to the comorbid patients who are having diabetes, hypertension, asthma, kidney transplant or dialysis patient, cancer patient. They should be given. Third point, children are more than 40 crore in India, and I will not agree with the speakers that they are not at high risk. I'm a pediatrician. I know that there are most of children, they suffered from the post-COVID multi-system inflammatory syndrome also. And we know that the data collection is not very good in India. There are so many children in rural area also, they were having a similar illness after 6 to 8 weeks of recovery from the COVID. So that was not captured in any census. That's why it was not. It means they are at high risk, they are vulnerable, they are unimmunized. At least primary immunization should be given to them. And why don't know why government is not acting on that. Already the vaccine has been approved by CDSCO, SCPC, DGCI. There are 2 vaccines available right now, Zydus-CoV-D, and the second one is Covaxin. Also, the Covishield is in pipeline. But 2 vaccines are available. They are having doses also. There is some negotiation, I don't know, going on regarding pricing or something like that. But it should be rolled out as early as possible. We don't want to compromise on children because now they are exposed and high risk. And I would like to tell also COVID-appropriate behavior. The social vaccine is most important vaccine that can prevent from any droplet infection, including COVID. Any strain can come, but we can prevent from the COVID-appropriate behavior. And now all people in India, they are not following COVID-appropriate behavior. Even government is not taking any strict actions. Now it's again high time that we should implement these COVID-appropriate behavior at ground level, at any place, and all the public should be aware. They should be educated. They should be trained regarding masking, regarding hand hygiene, regarding respiratory hygiene, because now this is need of the hour, because if we cannot prepare ourselves in 2 months, we cannot put so many extra beds in 2 months, we cannot put ICU beds, we cannot train doctors or nursing staff within 2 months to tackle 15 to 16 lakhs cases per day. This is not possible. And I am telling you, in India also, or all globally also, what we are seeing, it is tip of iceberg. With every positive case, there will be like hundreds of positive cases, they will not be detected because they will be asymptomatic or they will not be diagnosed. There will not be investigation done on these patients. It means we need to be very proactive, very futuristic regarding the number of cases can happen in next 2 months and what can be prevention and how much we can delay that surge that can happen in month of January or February, that can be delayed. For that, strict measure has to be taken from the state government, also from the central government. And I think the political rallies, whatever happening in, like there is coming in day, there will be elections in the different states also, and there will be different type of religions and gatherings are there. So all the public gathering, that can be political rally, religious rally, or personal rally, marriages, everything should be banned for at least 2 to 3 months. We should wait and watch. If everything is okay, then we should again open all these things. But otherwise, those things, whatever is not necessary for current economy, they should not be opened. Like political rallies, and even most of things can be done right now online. It is not advisable to go for physical rallies nowadays. So I think political...
Okay, so you're raising the red flag on the upcoming election rallies as well, because we saw what happened after the Bengal elections.